Hey everyone, today on this episode we are going to talk about why it's so important to not sleep on the 4 to 6 week re-eval. Stay tuned. Hey friends, welcome back to the Grow RDH podcast. Today we are talking about something really important in periodontal therapy, and that is the 4 to 6 week re-eval. Now, I know that a lot of practices aren't doing this, and that's okay, but hopefully after today you might be convinced as to why this is an important re-evaluation to incorporate into your periodontal practice. There's a couple different reasons why the re-evaluation after 4 to 6 weeks post non-surgical therapy is essential in order to get us to where we want to be with our patients and their periodontal condition. It's really not just a follow-up. It is the moment of truth, I guess. It is the place and time where you are determining whether your non-surgical periodontal therapy was successful. And what we teach in school, and what I think is really important to remember, is that our non-surgical therapy isn't necessarily complete until that 4 to 6 week re-eval has shown that the pockets have healed. If they haven't healed by 4 to 6 weeks, that means our treatment was not completed to its full potential. And I'm going to take you all the way back to dental hygiene school, and we're going to talk about the difference between refractory and recurrent perio. Unfortunately, if we are waiting 3 months after our SRP is done to evaluate, it is too long to tell if an active site that they still have now is recurrent, which means it healed after scaling and rib plating, but now it's reactivated. It's inflamed again, and as part of the periodontal maintenance procedure, we retreat it. Or it's refractory, meaning it has never responded. It's not responding to normal conditions. And the only way to know if a site is refractory or not is to do everything we can in the office to get it to heal. And unfortunately, 3 months is just really too long to tell that, because that's how long it takes for that biofilm to repopulate to the levels that get it to be that pathogenic and get it to reactivate down in the pocket. If we have the patient come in for their 4 to 6 week re-eval and we have sites that haven't healed, that means our non-surgical therapy is not complete. That could be for a number of reasons. We might have a vertical defect that we didn't see on the radiograph. It could be that we have some burnished calculus under the pocket, which I think happens all too often. Or the patient may be not able to adequately care for it. Or that site is refractory, meaning it needs periodontal referral, and it is outside of our bounds. We can't treat it. 4 to 6 weeks is that timeline because that's when we see the healing. 4 weeks is too soon. After 6 weeks, it's too late. So within that 4 to 6 week time frame, that is optimal to tell if our non-surgical therapy worked. If we wait 3 months to see them and they have active sites, it's just really hard for us to tell. There's really no way to tell if that pocket had healed. It's too long of a time frame. If that pocket healed, there's a chance it's recurrent or refractory. We really don't know. I think it's important that we don't sleep on the 4 to 6 week re-eval. And I picture the re-eval as kind of like this crossroads. It's a fork in the road, right? You either have healed and you're in remission now. You can maybe do some subgingival irrigation and then schedule for periodontal maintenance. Or you have to retreat or look at potential adjuncts. If you have a pocket that didn't respond to non-surgical therapy, this is where we identify those really tricky areas. Like I said before, it could be a vertical defect that is not visible on the radiographs. If that's the case, we need to refer that out. It could just be a really tricky site, or the patient could be immunocompromised. Looking at other adjuncts at this 4 to 6 week re-eval is essential to get our periodontal therapy completed. Adjuncts could look like a couple different things. It might be adjunctive antimicrobials. It could be laser. It could be laser-assisted periodontal therapy. There are a number of things that we know we can do on pockets that aren't healing. And that 4 to 6 week re-eval time is the perfect time to do that. This is also a really good time for us to identify any home care issues. A lot of the times, if we have healing and the tissue kind of shrinks down back to that normal healthy level, those patients might be left with a lot larger embouchure spaces than they're normally used to. And with larger embouchure spaces comes a lot more trickier home care. You're going to have to be starting to recommend those physiotherapy aids like interproximal brushes, water picks, all of those advanced aids way beyond just the normal toothbrush and floss. The 4 to 6 Re-Eval is a great way to identify that. You can see where their embouchure spaces are opening up. You can see areas of plaque that they are not able to get. Like I said, you can see recurrent areas. You can see sites of healing that haven't responded. And bottom line, if the pocket remains active, your non-surgical therapy is not complete at that point, which essentially means that patient is not maintenance ready. And I can't say this enough, but if this is a case where you believe that it's not responding because it's too advanced of a case, we need to refer those out. So next I want to talk about just what we do at the Re-Eval. Essentially, we want to do a full periodontal evaluation again and compare it to the baseline. That is essential. We have to know what the response was to our therapy. So we have to look at the baseline and compare the baseline to the 4 to 6 week Re-Eval perio numbers. We're looking for change in cal, we're looking for reduction of pocket depth, we're looking for bleeding. And anywhere that we have continued bleeding, we have still an active site. We can also ask the patient about sensitivity. Obviously, if they have more root exposure, they might have more sensitivity. This is an opportunity to do hard tissue desensitizing with them, and it's an opportunity for reinforcement of home care. One of the biggest questions then is, do we instrument at this time? And I always tell my students, I never like to waste an opportunity to subgingivally irrigate. So even if you have healing and you have a normal periodontium, your pocket depths are looking really good, you still have the opportunity to take your Pavitron subgingivally and flush everything out one more time. That just gives you an additional opportunity to disrupt that biofilm down in the pocket. That's important because it extends your time for your perio maintenance as well. We know we base that periodontal maintenance on the pocket depth and how cleansable that pocket is for the patient. So if you can subgingivally irrigate and disrupt the biofilm one more time, that gives you a solid 3 months again from your Re-Eval time, 3 months to periodontal maintenance, instead of doing a 3-month periodontal maintenance right after a non-surgical periodontal therapy. So I recommend to do subgingival irrigation at the Re-Eval because it's just one more opportunity to disrupt that biofilm. I think a lot of the times that offices see the 4 to 6 week Re-Eval, unfortunately, as this opportunity, as this missed chair time, right? It is having the patient in the chair and there's really not anything billable that we can do because the 4 to 6 week Re-Eval really isn't associated with a billable code. But what I want to offer you is there are things that we want to do if they're not responding that you could potentially bill out for. For example, if we're talking about our adjuncts, we can bill out for adjunctive antimicrobials. If we're talking about hard tissue desensitizing, we can bill out for those services. So while at the forefront of it, it may not seem like billable chair time, I think the potential is there. And I don't want to sell the 6 week Re-Eval as like some money-making strategy. That's really not what it is. But I think that would be an argument to bring forward to your dentist or your DSO in order to get them to grasp onto the 4 to 6 week Re-Eval more openly. I do think that it's a really important part of the periodontal process, right? And that's a big difference. If we don't know if the patient has recurrent or refractory disease, I think we're missing out on a lot of cases that should be referred. I think we are under referring because we don't know at that periodontal maintenance visit if that pocket ever healed or if it's just recurrent. Again, it's too long of a time. And sometimes this can even come as complaints from the patients. I am sure that they took a lot of time off of work just to get their non-surgical periodontal therapy done. And now you're asking them to take another office visit and come in again for that 4 to 6 week Re-Eval. But like I tell the students, it's all about how you present things to patients. If you're presenting the cavitron as this big awful thing that hurts and is sensitive and I'm sorry you have to do this, they're not going to want to do it, right? But if you sell the cavitron as this bougie, extra, spa treatment for your gums, that's what I like to call it, especially with my offenders in the prison. I just tell them, like, this is like a spa treatment for your gums. This is essentially a really deep, thorough cleaning. And, don't talk bad about it, talk it up. It's all about how we present things. And if we can present things to patients as this desirable thing, they're not going to be as unwilling to do it as they were if you're presenting it as this chore, as this extra thing that they have to do. And so that's just kind of like my little soapbox of how we present things to patients. And the 4 to 6 week Re-Eval is really no different. Present this to them as they have spent and invested all of this time and money into the non-surgical periodontal therapy. This 4 to 6 week Re-Eval is essentially, being thorough and making sure that therapy that they invested all this money into, that really worked and we're really thoroughly taking care of their mouth and checking. And I think when you present it like that, I think it's hard to say no to. If you make something a non-negotiable, it becomes a non-negotiable. When you make something that's negotiable, then people are going to try to negotiate. And on that positive note, it's a really great opportunity for the patient to see all the good work that you did and that they did. It's a great opportunity to talk about healing, to talk about good home care, the things that they're doing well, to build them up and make them feel like they've invested this time and now all of the good things that they've been doing are working. And even if, maybe they're not doing as well, I'm sure you can still find something good to come out of it or to talk them up. And that is my short little discussion today on the 4 to 6 week Re-Eval. If you are not currently doing 4 to 6 week Re-Evals with your patients, I hope today maybe has just shifted your mindset about what the 4 to 6 week Re-Eval is and why it's important. I would highly encourage you to try and implement this in your offices to make sure, one, we're identifying patients that have healed, identifying refractory patients that are not responding to our therapy within the normal healing time. And I hope you see it now as a non-negotiable. This is really important. It's an important part of our NSPT, and it's an important part of how we discuss and how we take ownership of the NSPT that we're doing. If this resonated with you, please share with a colleague, share with a dental friend. And if you're valuing this content, please like and subscribe. I really appreciate the support. Put in the comments down below whether or not you do the 4 to 6 week Re-Eval and what kind of policies your office has to implement this really important piece of NSPT. Thank you for joining me. Next week, we are going to be closing out Perio Month with an interview from Noriana Pryor. She's going to be talking about the perio view. It's an endoscope that allows us to see subgingivally, which is just absolutely amazing. I loved getting to talk with her, and I'm really excited to share that episode with you. Hopefully you're excited about that as I am, and I will keep you posted. Stay tuned. In the meantime, have a great week.